So, Picara was actually recommended to me by a friend of mine. Through someone I knew, and it was during a time when, uh, I was, we were trying to have, to expand our family, and we were having some trouble getting pregnant, and so she supported me through the whole process. Um, I think it was while I was seeing her that we started talking. Like, she was sort of talking me through different options of getting medical support, and ultimately help me figure out how to navigate all of that. And so doing you know moving from meeting with a doctor to making decisions around IVF. And I did, many rounds. And then, I think she and I have talked about, like, found, found a different doctor. And it was really, really hard, but she uh, really helped to ground me during the whole process. And your body goes through so much. So, you know, it's such a stressful process. So um, she was just really instrumental in helping me to um, sort of come back, into myself, um, in a way that felt real and um, felt healthy and felt good. Because infertility is really it's really challenging to deal with, just emotionally and physically. So um, yeah, and then it ended up, it had a happy ending. A lot of doctors wouldn't even accept my case. So yeah, so she encouraged me to take, to take more steps. And so she, I don't know, like, she kind of felt like an advocate, as well as like somebody that could look at, like, okay, like, here you are at this point in the treatment, and, like, this is what you need based on what so she gave me herbs at one point. And there's just, they can make predictions, but there's a lot of unknown. um so um yeah, and when the doctor that I went to, that I eventually kind of connected with, and that was ultimately, in many ways like Bakar, I think, in that he practiced in a holistic way, was very supportive of acupuncture. And um, you know, because, I mean, there's a lot of there's some debate on, like, how the effects of stress on fertility, but a lot of women don't even make it to the doctor because they're so scared of the whole IVF thing. So um, I just felt so much stronger and so much more um, support. I don't know. She was just a really important part of my support network that helped me to get through that time. Um, so, because yeah, it's like a job. It was like a full-time job for like 8 months. Yeah, and then what you're ultimately trying to do is a big thing. Any like, being pregnant. So then you're, like, leading up to actually being pregnant, which I don't even think at the time I was like fully emotionally ready for, or would have been, without some sort of support through this process. I don't know. It's a crazy thing to get pregnant anyway, like, that's like its own, and she supported me through that too. So, because then now suddenly you are pregnant, but it's like an IVF pregnancy. And so there's, like, when you're over 35, they tell you that you should try for 6 months, and then if you can't get pregnant, then you should go and see a doctor. And so that at some point while I was trying, that I went to her. in the earlier part of that. And then we did 6 rounds, and that was over like an 8-month period. So yeah, it was between a year and a year and a half with her, prior to getting pregnant. And then while I was pregnant, so I was seeing her for probably a year and a half to 2 years from when I started seeing her to when I actually gave birth. She's a healer. Yeah. I mean, I think, she's a therapist, she's a doctor, she's many, um, you know, like from what I understand, she considered going into like mental health treatment. That was like one direction that she was considering, prior to getting her training and certification. So, um, yeah, she's many. I mean, she's a friend. I consider her to be a friend at this point. It's just very hard to find a doctor that's even going to listen to you. There's this big gap in healthcare right now where, doctors, they they can't afford to work in private practice, so they're all working for hospitals, and they're having to see so many patients. And now there's this push against even taking. It used to be where you could see, if you paid out of pocket, you could still see the doctors that you want to see, but now doctors are turning away patients, that if they don't take their insurance or if they're not part of their network. Um, and so now you're very limited, not just by your insurance directly, but indirectly. So then, I don't know, like I look at her as, she is my health insurance, because there is no health insurance. you know I really feel like there's no health insurance. Like, what is health insurance? It's like a health racket. So I feel like she's, I like the space I have with her, I can talk about if there's some strange thing happening with my body, and like, and helps me to kind of have a cohesive story so that I'm ready to present it, to my doctor, or to sort of figure out like what I need to do kind of holistically about it. Because not everything needs medication. Like sometimes you just need to get more rest, or sometimes, you know, we like live in this really fast paced, overstimulated time when everyone expects a quick fix and is not really stopping to think about like things that really matter. Like, we should drink more water, like just really simple things. It's so important, as a health professional, as a mental health professional, like, it's important I have to be healthier than the average person. I can't, because I need to have bandwidth at the end of the day to be able to, you know, um, take care of myself and take care of my family. And you know, I can't afford to, literally, like, I can't afford to leave anything really neglected, for myself, within myself, um, with my own body and in my life. Like so it's especially important. Um, and unfortunately, I think a lot of, because of the way that the healthcare system, is, and the pressures of modern life, there's like this disconnect. And there, I think a lot of practitioners, obviously not just therapists, but doctors and nurses, and they're working too much, and they're not taking enough care of themselves. So I have gone back to see her. It's something that I think that I learned a lot about acupuncture through that experience. And so, of course, I'd rather have not gone through that, but ultimately it taught me a lot about the importance of body work. It was during that time I also, learned a lot about meditation, and I don't know. So, I've become like a real advocate of body work with my patients. Like, that's a really important. I encourage everyone to consider acupuncture, to consider, to exercise. I talk a lot about body work with my patients. And so for me, it's like a no brainer. Like, if there's some kind of stressor in my life where there's some kind of uh like thing happening with my body, I always think acupuncture. Um, so yeah, and I mean, because my son is, he just turned 4. Uh, it was a little harder to get into her when he was really small. But yeah, at a certain point, you know, it can be really, I think it can be beneficial for women postpartum because your body takes a long time for your body to, especially with a C-section, because it's like major surgery. It takes a long time for your body to like fully adjust and recover from that. Um, you know, Motherhood is a very physical job. There's breastfeeding. Kids, they need a lot physically in the early years, and so um, and it's a process figuring out uh, how much do you care for, and how much do when is it important to put yourself first, and that's like its own.